Well, good afternoon. I'm Dr. Greg Postal. I'm chairman of the board of the University of Louisville Physicians. And thank you all so much for being here today to share with us this inspirational story. I'd first like to express my appreciation to Lessya and her cousin Oleg Senek for being here today and for allowing us to share this incredible story with all of you. For those of you who have not heard the story, Lessya was misdiagnosed with cancer at the age of 19 in Kazakhstan. The treatment that she received left her disfigured and sent her on a 10-year odyssey of hope that covered 2 continents and eventually has brought her here to Louisville. As a physician with the U of L Physicians Group, I am thrilled that one of our own group members, Dr. Jared Little, has volunteered to perform the surgeries that will be necessary to reconstruct the mandible and allow Lessya to begin a new life. Dr. Little is one of more than 600 physicians who make up ULP, which is the largest multi-specialty physician group in this region. Our physicians represent the clinical practices of the faculty of the University of Louisville School of Medicine, and we advance our field through our work with the school, and we feel offer each of our patients an unparalleled level of compassion and quality of care. In addition to Dr. Little, I do want to make special note of the University of Louisville Hospital, which is part of the Kentucky One Health Network, and thank them for generously agreeing to support this project as well. They are donating the entire cost of care related to these surgical procedures. Today, you will join with me in hearing the incredible story, and Dr. Little will talk about what steps are to take place next. In addition, you will be able to follow Lessya's story on our website at a special page called Hope for Lessya, where we'll be able to follow her progress as she goes through these various surgeries and procedures. So with that, I take pleasure in introducing Dr. Jared Little.
Thank you very much. My name is Jared Little. I'm with the Division of Otolaryngology, Head and Neck Surgery, as well as the Division of Plastic and Reconstructive Surgery here at University of Louisville. I was on call one night, and I got a call, I think 9 o'clock at night, from a distant relative of Lessya's, who was a physician here in town, and he said his long-lost cousin was coming into town and had a problem with her jaw and asked me if I'd see her. She finally met me in the office, and she went through this story which just made you want to cry every time she laid out the next sentence. You know, this started, I believe, back when she was 19. She was pregnant and was at a volleyball game, I believe, and someone fell on her at the volleyball game, and she felt a small crack in her jawbone. She went to see her physician there in Russia, and instead of telling her that she just had a broken jaw, they told her that she had stage 4 squamous cell cancer of her jawbone. In the absence of adequate surgical facilities there, they elected to treat her with full-dose chemotherapy and radiation therapy. And that subsequently left her with this disfiguring problem on her face. It developed a large hole on the side of her face that goes all the way into her mouth and severely affected both the face and her jawbone. Evidently, every time she would go back and see the physicians there, they would tell her that her cancer has not been cured and that it's still there. She had difficulty with accessing adequate medical care there as well, and future and problems with her next pregnancy in terms of finding adequate medical resources. Luckily, someone finally got her to Moscow, I believe, and she had consultations with plastic surgery as well as medical oncology there. After re-reviewing pathology slides approximately 8 to 9 years later, they realized that this was not a cancer, in fact, at all. And, you know, this is something that we run into occasionally. There are benign tumors of the jawbone that when you look at them underneath the microscope, they can be mistaken for malignant tumors. And in the absence of specialized centers, that can happen more often. And so that's probably how this arose. Nevertheless, she's been dealt with a hand that's very difficult to deal with. She has a lot of difficulty with speech and swallowing. Eating is a huge ordeal. She can't open her jaw at all. and so she's unable to chew anything. I believe she's got a small area behind the back of one of her teeth that if you pull food apart small enough, it can be jammed back there and she can swallow food. But beyond that, chewing she's unable to do so. You know, Kentucky has one of the highest rates of head and neck cancer anywhere in the nation. In conjunction with University Hospital and James Graham Brown Cancer Center, we've developed a specialized team of physicians here who take care of patients with problems just like Lessya's. So we see a lot of issues similar to this. This is not the first time that we've treated this kind of issue. Thankfully, she got here so that we can help take care of her. And I look forward to getting started with the process. It's not going to be an easy process. It's going to take multiple stages. I think our first procedure starts next month, and that's going to be kind of a smaller procedure. We've got multiple problems. One of the problems is that this large hole that goes all the way into the mouth through the cheek, all of the tissue around this area has been heavily radiated, so it's damaged as well. So we've got to separate off the mouth from the outside world. And to do that, we've got to bring in good, healthy tissue that's not been radiated. The jawbone has been affected as well, and the bone is not very healthy at all. It doesn't have good blood supply. It can't move, and is under the threat of infection every day. In addition, now we've got a problem on the outside as well, on the outside of the face, because we've got to replace all of this tissue with good, healthy tissue. Our first stage will be coming up next month, and where we put what's called a tissue expander in her neck. Basically, it's a balloon underneath the neck skin, and we slowly start to inflate that balloon, and it stretches out the skin of the neck. Our next stage will be the larger surgery, and at that point, we will remove a bone from her leg that's attached to the skin and blood vessels, and that flap is what it's called, which contains skin, bone, and blood vessels will then be transferred up to her face. We will remove the diseased jawbone and reconnect all of the blood vessels to the big blood vessels in the neck. The bone from her leg will then be conformed into a new jawbone. The skin from her leg will become the new inside covering of the mouth. And then the area of skin that we've stretched out will then be used to resurface the outside of the face. The nerves that control the movement of the face are also in this very heavily radiated area, and they may not be very healthy at all, and those may need reconstruction as well. So overall, this is going to be a multi-stage process, but I'm confident that we can get her back to functioning, and you know, her story is just amazing. You don't hear this very often, so I appreciate Lessya and Oleg for coming in and allowing us to help her with this.
The story started when Lessya was born in 1983. Her father lived in Ukraine. He came back from Russian army, and he decided to settle in Ukraine, in Kiev. And we had, he got married in '83, and Lessya was born in October. Since she was born until she was 3 years old, I did babysit her pretty much every weekend. And in 1986, they decided to move to Kazakhstan because her mother's mother was sick, and they had to go and take care of her. They left in 1986, and I haven't seen them since. In 1991, Soviet Union collapsed, and all the country changed. The names of the streets, phone numbers, languages, everything was changed, and we could not get connected again. For all these years, all of us, all my family, my grandma, who was missing her son more than 20 years, and Lessya and her mother, and her daughter was, her sister was born in 1987 in Kazakhstan, so we couldn't connect them and we couldn't see each other. All the letters were sent to Kazakhstan or back to Ukraine were not received. So I moved to the United States in 1996, and I started living my life here and pretty much thinking every day about where are they? How could whole family be lost? And later on in life, when we started having access to computers, I started searching and searching and searching. And Lessya, her father, and her mother were not ever anywhere to found. And in 2012, in January, I finally went online and I was trying her sister's first name, and I put my last name to find. And at that time, her sister just posted her pictures of her wedding on web, and I was thinking, maybe it's her, but I've never seen her since she was born. And I started looking through all the wedding pictures, and I recognized her mother, but I didn't see neither Lessya, neither my uncle on the pictures. So I started contacting her sister, and I was asking, please give me an answer, where are they? And one day, after probably about 2 weeks, she responded, and she says she didn't know who I was, and she was afraid to say that to her mother or even to her husband. She thought maybe it's a scam. She didn't know who I was and where I was. And then finally I did call. She left me phone number. She left me a little message saying everything's fine. Parents are separated. Lessya has cancer, and she has a big hole in her mouth. I called. She left me a phone number of her mom. I called her, and first few hours, of course, we were just crying, happy to find each other. And after that, I said, please find someone who have computer that I could actually see if it's you guys, because I couldn't believe if it was them or not. So they went on Skype, and I finally saw them, and I couldn't, my sister and I, we couldn't just stop crying, and we were so happy to see them. And then I started hearing the story what happened with Lessya. When she was 19, she was married. She got married a little bit younger, and she was married. She had a little bit boutique store. They have happy life, and one day they went to this event in basketball, and one of the fans accidentally hit her in her jaw, and first it was swelled up, and she didn't know what was going on. She was young and beautiful, and she thought, I'm gonna go and get it checked up. The first doctor she went, he says, well, I need to get syringe to try to get liquid out. He couldn't do it. Then he says, well, we need to make a little incision and check for biopsy. But the place where they live in Kazakhstan did not have anything that they could have that test. So they sent the biopsy thing to Russia. And she had to actually go to Russia to pick up her test and bring it back to the doctor. When she brought it back to the doctor had to break up the bad news. He says that she had only 3 days. I'm sorry, 3 days to 3 months to live. And they prescribed her 60 radiational treatments and chemotherapy. When she went through radiation, she could not move. She was in pain. Her headaches were awful, and she could not get off the bed. At that time, most of her friends and classmates came to say goodbye. Then, one day, she decided that she needed to go and start living her life. She was totally rejected by society. She couldn't find a job. She couldn't go with this study. She lost her business, and she ended up with nothing. Only pain of thinking that today might be her last day to live. And they were hopeless. Nobody could help her. At that time, Soviet Union collapsed. Her father lost his paperwork. He could not function as a normal person. He was called person without citizenship. He couldn't go back home to Russia or to come back to Ukraine, and he could not live proper life in Kazakhstan. So he couldn't help her. Her husband was in and out of her life. She was trying to save the family. She was doing jobs like sweeping streets at night so nobody sees her. Some nights, she would just put sand on people's stairs, so they don't sleep on the winter. That was her job. And no one would hire her. In 2000, she couldn't even get an apartment for herself because people from the ad would meet up with her to get a deposit, and then they said, well, we don't know if you're contagious or not. In 2006, she got pregnant. And none of the doctors would help her with prenatal care. She did not know if baby would be healthy. She did not know if it was boy or girl. She did not know anything until the day when she had Eric. After she had Eric, with her struggling with life and all this, doctors did not want her to have him, but she says, if God gave me a baby, then he won't take me away from him. Her husband left. And she couldn't find a place to live. So she was offered to live at the car wash utility basement. This is where she worked at night, or some days also. And she lived there until the day when I found her. I found her in 2012, and I decided to bring her to Kiev, where I have more connections and I have lots of friends, to Ukraine, to have her check up. And the oncologist there, he looked at all the paperwork. They test her for anything that they could. He called us after she did all the testing, and he says, I want to meet you on Thursday at 3 o'clock. I couldn't make it. I asked my best friend to go, and I couldn't hear it from doctor if it was bad news. When I met Lessya, she was 79 pounds last year, and I didn't think she had any hope. I asked my friend to go to doctor for results. And they called me 1.5 hours later and saying they were crying. And I didn't think we had any hope. But we found out that doctor called and he says she never had cancer. She was misdiagnosed and mistreated. And this is when I knew that she has hope, and I decided to bring her to the United States. And at that time, thanks God to Dr. Jared Little to be in our life. I'm really grateful. I'm grateful to all my clients who support me with that too. Because Eric, her son, couldn't even go to school. Because after she gave it birth, they didn't even vaccinate him. So his vaccinations he had here in the United States, and he's perfectly healthy, and they're really happy. He's going to first grade right now, and we're trying to build a new future for Eric and Lessya. Thank you, everybody, for all your help, all your prayers. Thank you.
Might open up to some questions.
I want to ask Dr. Little, can you expound a little bit? Is this all donated? I mean, is this out of the goodwill of you and others here? how is this going forward?
Yes, sir. For, when somebody like Lessya comes in with this kind of problem, their insurance status is irrelevant to me. So we're going to take care of her through the whole thing. And, I'm donating our time and expertise to do her procedures. University Hospital has agreed to support the whole project. So it'll be a multi-stage project, but yes, we're all donating our services to her.
And give me some idea of prognosis here. I mean, you've had expertise in so many other areas. I don't know if you've ever faced this before. That's the first question. But in terms of prognosis, are we going to see her return to normal?
There'll never be a normal the way it was before all of this started. I think our goals are to reconstruct her jawbone so she can eat, so she can talk, so she can swallow, she can function in normal society without having the stigmas that have been associated with her. We're going to have to reconstruct the outside of her face. I think all of this can be arranged and can be accomplished. This is not the first time we've dealt with this situation. So yes, I think that all of this can be accomplished, and I think I'm very confident that we're going to be successful in getting her back to being a normal functioning part of society and get her back to the way she needs to be.
Dr. Little, obviously you're dealing with the physical aspects of this. How is she dealing with all of this emotionally?
I don't know. I can't imagine how she's doing it. I certainly couldn't. I mean, this story, every time she says, the next sentence makes you want to cry. I think it's in large part due to Oleg here, who has spearheaded all of this and arranged for her to get here so she can have so her son can have a normal life and be educated, and so that she can get here to specialized medical services that we can help her with all of this. So it's all due to him that she's able to make it this far and be successful with this. So it's 100% due to him. She's been unbelievably strong through this whole deal. I mean, I don't know how anybody could do it, but she's doing a fantastic job. She's raised a very healthy, beautiful boy, and it's more than anybody could ask for.
You have 2 surgeries scheduled at this point. Is it fair to say that there will be multiple?
Yes, sir.
In addition,
Yes, sir.
in terms of after the reconstruction, plastic surgery?
Yes, sir. The first 2 surgeries are the 2 main surgeries. After that, I expect there will be some more minor procedures down the road. But the first 2 surgeries are the primary ones.
6 months, 12 months, what's the timeline to when you complete with these surgeries?
I expect the first surgery to be next month, and that's going to be a 2 to 3 hour surgery. The next surgery is in January, and that's likely to be a 20 to 24 hour surgery. Following that, each successive procedure will be small, outpatient kind of surgical procedures.
So will it be January when she has function?
Tentatively, yes, sir.
Is it your diagnosis that it was a benign tumor or non-cancerous tumor that she had?
Now, it's difficult to access those records and to actually see we don't have the pathology slides themselves. But this is not an unheard of story. There are benign tumors of the jawbone, which, if you're not accustomed to looking at them underneath the microscope, or you don't have specialized pathologists like we do here, they can be mistaken for malignant tumors.
Is there any risk here? I mean, beyond the normal?
Sure.
I mean, is this especially complicated, or how would you describe it?
Yeah, yes, sir, it is. There's only a few centers in the nation who specialize in this kind of care, and because of our extensive time and number of patients we take care of in Kentucky, because of our high incidence of head and neck cancer, we're lucky enough to be one of the facilities that can do this procedure. It is a risky procedure anytime you go underneath anesthesia for potentially a 24-hour surgery. It's certainly risky, but this is not the first time we've done this. I feel confident that we can get her through this just fine.
And the misdiagnosis, it was based on a biopsy?
Yes, sir.
Well, like, how far apart? You said that you used to babysit.
Yeah, I was almost 12 when she was born.
Dr. Little, how is Les's health otherwise? Is she in good health?
She gained 50 pounds.
Yeah, she's in remarkable health. I mean, another part to this story, which I don't know that we all knew about, she had gone to 79 pounds, I believe.
Yeah, when I met her first last year, she was 79 pounds, and
You should share that part about how she's
not,
where she got to where she is now.
No, now she's 126, and she's getting better, and we change her hair. We're trying to keep her feel normal, but she says that this is only the first time here in the United States she started feeling like she doesn't have to hide.
Oleg's very modest. He, you know, when they met with me in the office, he shared that, you know, when he saw her, she was down to 79 pounds, and obviously it would be difficult to get care for her in that kind of state, and so he began to send her money at that point.
And insure.
Yeah, and
the
exactly.
Shakes, I was sending her shakes, and
Access to
I
nutrition.
said, eat just whatever you see. Because last year when I met her first time, she said that she'd never tried pineapple. So.
But otherwise, she's in remarkable health.
Is she anxious for this to start?
The surgery?
Yes.
The most hardest thing it is to explain a 6-year-old boy that he's not going to be with his mom, that he's been always right next to her for all these years. It's harder. We work with him every day to prepare him that you're not going to see her for a few days, maybe a few weeks or so. That's hardest part for her, because they've been best buddies.
And what does she want to do with the rest of her life?
Since she missed so many years of her life, you know, she would like to go and become a nurse or something to help people, and just work. She was saying the other day, the simplest thing she wants for her is to bite on apple. She's never have done it in the last several years. And also, she had her birthday not too long ago, and we bought this cake and candles, but we didn't realize she can't blow the candles. It's just simple things like that.
Well, can you translate? Lessya, can you describe what this all means to you?
Ты можешь объяснить, что это для тебя значит?
Не знаю. Это все значит.
It means everything.
Я не могу сказать ничего.
It's hard to tell her for her right now. When she gets nervous, her jaw gets locked a little bit, and she can't pronounce certain words, so she's kind of. Or when she gets cold or something, it just gets to. And it's hard, just. I think emotions just overwhelming. I never thought a year ago that she could actually be up front of cameras. She wouldn't eat in front of me. She wouldn't drink in front of me first when I met her. She wanted to do it, that we wouldn't see it. She would hide to do it, because it's a whole process. We just take it for granted that every day how much of our mouth we use just for simple things.
Oleg, is Eric in school now?
Yes, his is the first grade, and he's trying his best. You know, he doesn't have English or anything. He came without English or anything, so he's doing his best. He's doing pretty good. We're proud of him.
And she hopes to become an American citizen?
Ты хотела бы быть гражданкой Америки?
Да.
Yes.
Is she here on a green card now?
Yes.
Are there any other questions? We thank you for your time. As you can tell, it's a very special story, and we're so pleased to be able to share it with you. Thank you.
Thank you.
All right. Thank you.
Thank you. Thank you.